मैम आवाज नहीं आ रही।
Yet I am not started, that's why. Getting my voice?
यस मैम।
Okay, fine. So, moving forwardly with BTPP, as we are doing a rubric handling under chapter sensation and complaint of in general, air aversion to open, air desire for open, anxiety, general physical, apoplexy, burns, biting, chlorosis, cardiology, carried desire to be, convulsions, epileptic, hysterical, dislocation. So biting and dislocation are important rubric. Cyanosis, again it's an important rubric. Cold tendency to take, cracking of joints, dropsy, emaciation, faintness, gout-like pain, hysteria, hypochondriasis, jaundice, skin yellow, sit inclination to, lie down inclination to, obesity. Obesity again very important rubric. Paralysis, polypus, scurvy, ulcerative pain, swelling sensation, sit inclination to. Sit inclination to given in Kant under section mind. So once again, I want to repeat the same that when we are using the repertory, it's maybe Bonnet-Ocean or Kant repertory. They are very limited repertory and the particular characteristic or important repertory basically known by all, that is Kant, Bonnet-Ocean, Boger, and synthetic repertory. So make a chart between Kant, BTP, BBCR, and just the rubrics which are repeatedly comes in our exam again and again. Just note it down with proper section under every rubric and sub rubric. Mention them separately in different repertory. Lie down, inclination to, given in generalities under Kant repertory, tearing in muscles, tension in joints, unsteadiness. Now, sensation, glands, induration, quivering, atrophy, traveling, sensations, bones, absence of marrow, sensation of curvatures, losing from flesh, feeling as if, carries again important under sensation, bones, injuries, necrosis again it's important. Now sensations, skin, chilblains, comedons in phase 2, corns, warts, gangrene, nails generally affected, brittle, deformed, splitting, lousiness, flaviness. Lousiness is very important. Flaviness, ulcers, bones, eruptions. In eruptions, chickenpox, carbuncles, fruncles, milk crust. Sleep and dreams, yawning, aggravation, amelioration, waking in distress, sleepiness during day, somna, amnestic, position in sleep, dreams, unremembered. Circulation, under circulation, blood, anemia, and in Kant, it given under generalities. Pulse, it's again important, pulse, hard, full, slow. So in pulse, particular under section circulation, there is characteristic of pulse, that is hard, full, and slow. So if you are having BTPP in your hand, just make sure that it is present or not. Now aggravations, children especially remedy for, women for, climatic during, coal gas, copper fumes, eruptions after suppression of, excitement, emotional, that is fright, grief, jealousy, scorn, mortification, etc. Spectacles, stone cutters for, Now in amelioration, mesmerism. Mesmerism is again important rubric. Sexual suppression, society aggravation, dancing, carrying the child in the arm, fasting aggravation, food and drink aggravation, loosening clothes, rubbing aggravation. Now, before going to important years in history of reporting, just I want to tell you some important points too. So, as we earlier read out about BTPP history, or like it's a part of introduction and introduction, there are 17 mental rubrics are given in aggravation chapter under rubric excitement emotional. Allen changed the chapter sensation and complaint into sensation. So in present scenario, Allen changed the chapter sensation and complaint into particular sensation chapter. Allen also changed the chapter, as we earlier talked about it, concordance into relationship of remedies. Why I am repeating this? The reason is only this, that these are the important point not only for your history or particular repertory subjects. It's all about for exam purpose. That is in MCQs. There are various questions occurred or asked by the examiner, that concordance given by which stalwarts, concordance having another name, what is that, relationship of remedies. Now 21 remedies into this chapter added by Allen. This chapter is useful for second prescription. So which chapter is used for second prescription from BTPP? So answer is relationship of remedies, which is given by Allen. So Allen's changed the chapter concordance into relationship of remedies. Marked it or noted down, or just take it in front of your notes. Now the relationship of remedies contains 142 medicine. Again, in every repertory, either Kant or Bonninghausen or Boger, I already told you whatever the additions means came in this year, whatever the new things added by different stalwarts. Medicine part means which medicines containing the chapters having like relationship of remedies having 142 medicine. In Kant repertory, how many medicine? In Kant repertory, how many rubrics in mind? So these are the important things. So you have to focus on these things. Now, Allen added large number of eye symptoms. In particular, BTPP, Allen focused on eye symptoms. This is also again important. Allen changed amelioration into aggravation for better adaptability of book. Kant criticized Bonninghausen generalization by he largely praised the relationship chapter of him. So here, as we know that Kant didn't like the plan and construction, even the philosophical background of BTPP. He always criticized that BTPP having the different pathological conditions and this. But even in Kant repertory, if you are habitual to use Kant repertory or not, but in philosophical background, that based on deductive logic, so there are also pathological condition, and can focus on relationship chapter, which is brought by BTPP. Each remedy under relationship chapter has 12 rubrics, though last two antidote and injuries are always not present. Now, important years in history of repertories. These are very important, very important things regarding the repertory. Repertory during the lifetime of Hahnemann. So 1805, in 1805, Fragmenta de Virus Medicamentorum Positivus Sive Insano Corporo Humano Observatives by Hahnemann in Leipzig. So 1805, it's very important. Once again, just note it, double note down. 1832, Repertory of Antisaurics, Bonninghausen. And important, what is important in 1832 repertory? That prefaced by Hahnemann. Very frequent question asked in various examinations, that in 1832, Repertory of Antisauric by Master Bonninghausen, but prefaced by Hahnemann. This is the first published repertory. So first published repertory is Repertory of Antisoric Bonning-Husson in 1832, prefaced by Hahnemann. In 1835, Repertory of Medicines which are not antisoric, given by Master Bonning-Husson. In 1836, an attempt at showing the relative kinship of homeopathic medicines, that is, were Safton Repertorium. This is the most important question till now, which is frequently asked in various examinations given by Bonning-Husson. So just note it down. Were Safton Repertorium in 1836, an attempt at showing the relative kinship of homeopathic medicines. So don't be confused with it. In 1833, first alphabetical pocket repertory. It is again very frequently asked question, which is the first alphabetic pocket repertory, by which author it is published dash in this year. So by Glaser, the first alphabetical pocket repertory which came in 1833. Once again in 1833, repertory of purely pathogenic effect Weber Pasteur. So by Weber Pasteur, repertory of purely pathogenic effect came in 1833. So here two repertory in 1833. First, alphabetical pocket repertory by Glaser and repertory of purely pathogenic effect Weber Pasteur. So you can learn through it also that in 1833 total repertory 2. Which repertory? This, and given by this author. Now in 1835, symptom repertory in 3 volumes given by Jar. In 1838, a repertory published in Allentown Academy. This is again important. A repertory published in Allentown Academy by Master Herring in 1838. Many of time question only is that a repertory published in Allentown Academy in this year, dash and dash. 1843, a homeopathic repertory of symptomatology, Lafayette, first Persian homeopath and the first original repertory in France. So again, question is, the first original repertory in French came in which year? So in 1843, first original repertory in French, a homeopathic repertory of symptomatology, that is given by Lafayette, and he is the first Persian homeopath. In 1846, BTPP, that is Bonning-Husson Therapeutic Pocket Book. In 1848, Systematic Alphabetical Repertory by Clofer Muller. This is again important question. Systematic Alphabetical Repertory Clofer Muller. So when I am saying that this is important means this is the question repeatedly and frequently asked in various competitive examination. So just note it down or make the star in front of it. In 1854, a repertory of comparative materia medica by Adolphe Lippe. In 1879, repertory of the more characteristic symptom of materia medica given by C. Lippe in 1879. In 1886, a repertory of most characteristic of materia medica, Winterburn. In 1897, repertory of homeopathic materia medica given by Master Kent. So, as we earlier learned about 10 properties, that there are various editions. There are first American edition and many more first Indian editions. So just memorize with this chronological order. When we are talking about the Kant property, then you have to go through all the editions with their another name, with their another publication, and just memorize about all the editions of Kant repertory. Now, regional repertories. As we know, this term is already explaining himself that regional repertories. So, particular reason, like like particular things, fever, it's not on the holistic base. It's just for particular repertories. In 1869, repertory of diarrhea. Again, it's important. So just make a star against it. In 1869, repertory of diarrhea given by Bell. In 1873, it's also important, repertory of eye given by Master Barries. In 1879, repertory of fevers, that is SC Allen, or many times it's very confusing questions when we are just facing in MCQs is we confuse that repertory of fevers by SC Allen and repertory of intermittent fever by WA Allen. And after seeing the word fever, we are just confused with SC Allen and WA Allen. So make sure that in 1879, repertory of fevers, only fevers, no intermittent fever, given by Master S.C. Allen. So, repertory published in 1879 by S.C. Allen is Repertory of Fevers under Regional Repertories. In 1882, Repertory of Intermittent Fevers by W.A. Allen. In 1880, Repertory of Respiratory Organs by Lutz. In 1880, it again important. In 1894, Repertory of Therapeutics of Respiratory System, Vandenberg. Repertory of Therapeutics of Respiratory Symptoms. So they both are different. In 1880, a repertory of only respiratory organs. But in 1894, repertory of Therapeutics of Respiratory System by Vandenberg. In 1906, repertory of respiratory diseases. So from starting 1880, repertory of respiratory organs. Then after respiratory organs, there is therapeutics of respiratory system. And after therapeutics, there is repertory of respiratory diseases given by Master Nash. Now, in 1873, desire and aversion. It's again very important question, so just note it down. Desire and aversion given by W.J. Garnishi in 1873. So, in year 1873, desire and aversion repertory given by W.J. Garnishi. In 1880, repertory of hemorrhoids. W.J. Garnishi. We can learn it through like this, that by Master W.J. Garnishi, as we see in our screen, that total 4 repertory. First, desire and aversion, repertory of hemorrhoids, repertory of mastitis, repertory of throat, given by W.J. Garnishi. So make it easy by using a column that these 4 repertories given by W.J. Garnishi in year. So 1873, Desire and Aversion by W.J. Garnishi. And after 7 years, in 1880, Repertory of Hemorrhoids by W.J. Garnishi. It's again important question too. 1906 and 1906, 2 repertory came by same author W.J. Garnishi, that is Repertory of Mastitis and Repertory of Throat. In 1880, Repertory of Modalities, Worcester, that is again important question. In 1883, Uterine Therapeutics. In 1883, Uterine Therapeutics by Henry Minton. So previously it is asked in our exam, that is our exam, uterine therapeutics. I remembered it, just take it down. In 1883, given by Henry Minton. In 1894, Repertory of Appendicitis, England. 1894, in same year, 2 repertory given by Master England, that is Repertory of Appendicitis and Repertory of Labor. Right, then in 1899, repertory of repertory of urinary organs, right? So repertory of urinary organs given by A.R. Now in 1905, so in 1905, BBCR given by Master Boger. In 1915, synoptic key given by Boger. So these all the repertories are very important as well as for examination purpose and even in our clinical practice too. With this new era condition of various diseases, BBCR is very good repertory for advanced clinical condition and modern disease condition as per pathological conditions. So now moving forwardly, in 1905, PBCR given by Boger. In 1915, Synoptic Key given by Boger. In 1931, Times of Remedies and Moon Phases given by Master Boger. In 1924, that is card repertory given by Master Boger. In 1904, a clinical repertory. It's again important that in which where clinical repertory came or Clark, which kind of repertory published by Clark in which year. So a clinical repertory by Clark published in 1904, 1927 clinical repertory by O.E. Borick. Both are important for exam purpose. 1937 Sensation as a by H. Robert. 1939 Rheumatic Remedies by H. Robert. 1963 Fatak's Repertory given by Fatak. In 1973 Synthetic Repertory H. Barther, W. Clunker. So it's a very important question. Synthetic repertory given by H. Barther and W. Clunker. Just learn it. Make it sure that you have to just note it down and put a star in front. It's very repeated question. Repertory of Possession Bharadwaj. 1996 Miasmatic Repertory by R.P. Patel. It's again important. In 1996 Miasmatic Repertory given by Master R.P. Patel. Now, in 1998, Homeopathy and Child Care, that is given by Dr. S.K. Tiwari. In 1990, Kent's Repertorium General by Jost Kunjli. It's again important. Kent's Repertorium General given by Master Jost Kunjli in 1990. In 1993, Homeopathic Medical Repertory given by Master Robin Murphy. It is again important. In 1993, Homeopathic Medical Repertory by Robin Murphy. In 1993, Synthesis Repertory, that is synthetic by Barther and Clunker, and this is in 1993 Synthesis Repertory, Frederick Sirons. This is again important question. In 1996, Complete Repertory. This is again important. In 1996, Complete Repertory by Roger von Jan Wood. In 1999, Phoenix Repertory or Phonics Repertory by J.P.S. Bakshi. In 2003, Repertorium Universale, Roger von Jan Root. It's again important. So by Roger von Jan Root, Complete Repertory and Repertorium Universale. Now, methods of repertorization. So total 6 methods. That is Essay on Homeopathy, Dr. P.K. Sarkar, in which first Hahnemannian and Bonin-Hussein method, where complete symptoms are available. As we know, every repertory having their own philosophical background and their own philosophical background with their different plan and construction. They having their own philosophy. Some believes in inductive logic, some believes in deductive logic, and some makes format of particular reason-wise repertory. So different stalwarts giving different importance to symptoms and systems. Like some give particular, some generals, and make them in a repertorial language with the form of different rubrics. So in Kant's method, where in generals, mental and physical. Here, Kant gives importance to mental as well as physical. So many of times, question is like that, okay, Hahnemannian and Boning-Hussein method where complete symptoms are available. So many times question is that complete symptoms used by or first given by broadly used by Master Henneman, Master Boninghoschen, Master Kent, or Boger, both of them, none of them. So it's important that we have gone through by these methods of repertorization. So in Kent's method, where generals, in generals, mental as well as physical and particulars available. Then third method is where mental symptoms are lacking. Fourth, where generals are lacking, depend on peculiar symptoms and keynotes prescription. Now, fifth, cases contain only common symptoms or pathological symptoms. Technical nosological terms are used as main heading. Now, as we know that different type of repertories published by different stalwarts like uh, general repertories like card repertories or regional repertories and so on. So in card repertories in 1888, first card repertory by William Jefferson Garnishy. So when we are talking about W.J. Garnishy, then we have to remember that previously we talked about different repertories given by William Jefferson Garnishy. So I think that you just remembered that we talked about just within few minutes okay, many more repertories given by Garnishy. So just learn it. Made available, just correlate from here. Okay, by Garnishy, which many more repertories given to us. Just memorize it within a second. Made available to the profession in 1892, based on Burning Ocean's repertory. 1912, punched card repertory by Emil Tyler, based on Kent's repertory. In 1922, Field's card repertory that containing 6800 cards and 360 remedies. So again important that in Field's card repertory 6800 cards and 360 remedies. One thing which I want to tell you that in 1912 Punch card repertory by Emil Tyler. So question is that which repertory that is card repertory based on Kent's repertory. Okay, so first card repertory by Amal Tyler. Or many of time it is asked that in which year first card repertory came or the punch card repertory based on dash and dash. So just fill it if you know that the question is that and answer is this. In 1924, bogus card repertory. It's again important. 305 cards and 250 medicine, 4 grades are used. In 1948, Marcos Jaminis published a card repertory made by his father in the year 1910. Introduction of gradation was first done in this repertory based on Boninghoschen's repertory colored cards, and that is 600 cards. So what is the important thing in these 6 lines? The important is, sorry, in these 5 lines. So important is that introduction of gradation was first done in which repertory? Okay. Based on Boninghoschen's repertory color cards, 600 cards, that is Marcos Jaminis published a card repertory made by his father in the year 1910. Now 1950, P. Shankaran card repertory based on Boger's work. So, what is important in this study is that we are learning about the card repertory and many more we already previously talked it that here mentioned that P. Shankaran card repertory based on Boger's work, and in previously we talked about that this repertory, Jaminis published a card repertory made by his father in 1910, which is based on Boninghoschen repertory. So these are the learning points. So these are the points which we have to learn. 1950, P. Shankaran's card repertory based on Vogel's work. It has 292 medicine and 420 cards. It's again important question for your exam purpose. Now in 1959, Jugal Kishore's cards repertory It's again important because this Jugal Kishore card repertory having 3 editions. In first edition, that is 1959, second edition 1967, and third edition 1987. Largest number of cards, that is 9980, 9980. So again, it's an important question that which is the largest card repertory or the repertory which containing largest number of cards. And please go through the editions, that is 3 edition. First edition 1959, second 1967, and third edition 1987. Jugal Kishore's card repertory, that is first published in 1959. Now, computer repertories. So, first computer repertory, Malenic in 1979 in Australia. LA repertories, D. Kent Malenic, Dr. George Browse. It's again important question. The Lamina homeopathic repertory analysis, HomePath by Dr. Jawahar Shah. It is again important. Cantian, Mac, Radar. Radar, it's again very important. If you are using computer repertories, then you are very habitual to such type of words like radar, home path, Mac. So radar, so first of all, we have to learn the radar, rapid aid to drug aimed research. So this is the full form of radar, rapid aid to drug aimed research. Again, it's very important. HRS, Polycresta dolphin cyprotic system. Cara installed at Royal London Homeopathic Hospital, Carolite, baby sister to Cara, Similia, Micropath, Microtherapeutics, England. So we are just read it because we are just reading it because we have to know that these are the computer repertories. Okay. Now, Organon 96. This is again important. Organon 96. Lastly, where I finished. Okay. Similia, Micropath, Microtherapeutics, England. Homeo Repertory, Dr. Robert McAlery. The Profile, DJ Wilrad. Organon 96, Dr. Dilip Dikshit. The Samuel, the Cooperative Association, Holland, Canbo. Radar. As I already told you that radar is clinically as well as for exam point, it's very important. So here we have to know that what is the full form of radar. Okay. So now moving forwardly, radar developed as a research project at University of Namur, Belgium under Dr. Fiche Fat in 1987. 4 grades: red, bold, capital, underline, red, bold, capital, blue, italic, and Roman. So it developed as a research project at University of Namur, Belgium under Dr. Fichte Fit. So important is that Dr. Fichte Fit. In which year? In 1987. So in radar, there are 4 grades used: red, bold, capital, underline, red, bold, capital, blue, italic, Roman. Note, first book form of radar came in the year 1993. That is 5th edition of radar. Now, Fragmenta divulgus medicamentorum positivis saevin sano corporo humano observatives. In all year of BHMS, we are very habitual to this word. You know why? Because author Hahnemann, written in 1805 in Latin, number of medicine 27. Okay, so I didn't finish my sentence that why we habitual to in our fourth in first, second, third, and fourth PHM is because the first book published by Master Hahnemann, that is Fragmenta de Verbis Medicamentorum Positivis Saevin Seno Corporo Human Observatis, which is divided in two parts, which you are just going through it. Number of medicines having 27. So this book containing 27 number of medicines. Again, it's very important. This full topic is very important. Two parts. So fragmenta de verbis divided in two parts. First called pars prima, listed symptom produced by drug. And second pars skanda, that is repertory or index. So many of persons like use the first part is materia medica, that is MM, and second part pars secunda, repertory or index, because in first part symptoms listed produced by drug, and in second part there is indexing. Now, preserved in Stuttgart Museum of Dr. Richard Hell. It's again important. So this topic is totally very important. Now, repertory of antisoric. So, repertory of antisoric, author Bonnie Hussein, first edition in 1832, second edition in 1833, and third edition 1900. Important is preface by Hahnemann. So preface given by Master Hahnemann. It's containing number of chapters, that is 45, number of medicines, that is 52, and 50 antipsoric with one antipsychotic, that is in antipsychotic thuja and in antisyphilitic merc. Now synthetic repertory, which having volume 1 and 2 by H. Barthel and volume 3 by W. Clenker. Here, one thing I want to tell you that both author having a different name. So don't be confused, like many of person are a little bit confused. They thought that Barthel and Clinker are one person. No. H. Barthel and W. Clinker, both different author. Volume 1 and 2 by H. Barthel and volume 3 by W. Clunker. In volume 1, mental. In volume 2, physical general symptom. So, if again I want to again and again I told you only one thing, then while you are just reading about the repertory, make sure that you just go through it, or just know that the what is the plan and construction of that repertory. So again here volume 1, that is having the mentals only, and in volume 2 physical general symptoms except sex and sleep. So here in volume 2 physical general symptoms covering broadly but except sex and sleep, and volume 3 that is sleep, dreams and sex. Okay, so in volume 3 sleep, dreams and sex. In first volume, that is mental, second physical general symptoms. Additions, total 3 addition, and first addition in 1973, second in 1982, and Indian addition. This is the important question. Indian addition, that is in 1987, and third one is 1993. Was published in German. Number of medicine 1594. Grades